People are still asking questions about the vaccine effectiveness and the COVID reinfection rate.
CBS 2's Ariana Piper asked a St. Luke's doctor how natural immunity compares to vaccine immunity.
Dr. Souza, chief physician executive at St. Luke's Health System, says hospitals are still operating under crisis standards of care and elective and non-elective surgeries are still on pause until around mid-October. St. Luke's is also continuing to care for patients in non-traditional spaces.
Patients in this surge are younger. Our average age, 2-week average, is 59 years, different from 72 years in the December surge. Our patients are almost all unvaccinated. Specifically, 90% of the hospitalized patients are unvaccinated, and 98% of the intensive care unit COVID patients are unvaccinated.
So if someone got COVID originally during the first strain back in the winter, how likely are they to be reinfected? And if they are reinfected, how likely are they to be placed in the hospital?
I've heard the term, it's a pandemic of the unvaccinated. I think it might be more accurate to say that this is a pandemic of the non-immune. We are seeing a very small handful of patients who have been vaccinated who get sick enough to be in the hospital or sick enough to be in the ICU. We see that. We see a few more patients who previously had confirmed COVID who end up sick enough to be in the hospital or sick enough to be in the ICU. And we have seen a handful of deaths in that group of individuals. But largely what we're seeing, right, is people who have either not been infected or not been vaccinated. Now, on that point, I can't help but miss the opportunity to say that if you're non-immune and you haven't been infected and you haven't been vaccinated, you have a choice to make. And you can either choose to become infected, because you will.
So basically what you're saying is, even if you've been infected before and in the past and may not end up in the hospital, you recommend getting vaccinated just for that extra protection?
Absolutely. Because of the treatments we would offer, we'd offer antibodies. So let's use our own bodies to make our own antibodies against this infection.
How long is the immunity from the vaccine so far? I know we're probably still studying and figuring that out, but on top of that, does that mean we have to still kind of keep getting boosters, or do you think over time we will figure that out more?
Yeah, I'm going to stick with stay tuned on that. I mean, we're following guidelines and saying, you've got to be post-vaccine 6 months. We don't know what a long-term vaccination program might look like. There's active research happening now trying to create a STEM vaccine, if you will. This meaning a vaccine that might provide broader-based immunity for not only this coronavirus, but other coronaviruses as well.
Ariana Piper, CBS 2 News.